going to be doing adult choking, lesson 4 for emergency care and prevention. I have my latex gloves right here. Right now it says, for the situation, you are on a lunch break with several of your coworkers. One of your coworkers is eating a sandwich and talking animatedly about the concert he attended. He suddenly gets a panicked look on his face and you ask him if he's choking. He cannot answer you. So basically, you have to size up the scene and you gotta form initial impressions. And you gotta look to see what's going on. So if he has a panicked look on his face, if his hands are obviously like this, he's making obvious body language, obvious gestures that he is choking, and a responder is nearby, perfect. You can ask for a responder to be there. If not, that's when you would have to take matters into your own hands. In that case, you are the responder. So basically, you would size up the scene, size up the situation. So is the scene safe to enter? In this case, you were just out eating with coworkers when your one coworker starts choking. So yes, in this instance, the scene is safe to enter. So you would enter with no problem. What happened? Your coworker was eating and you were there. He was talking animatedly about a story. He started choking. And you don't know if he was choking, but he didn't respond, and he was making obvious gestures, and he suddenly stopped his whole conversation, which he was animated about. So the signs were there. How many people were involved? In this case, it was just one coworker. He was choking because he was eating. So that would be right there how many people were involved. What is the initial impression about the nature of the person's illness or injury? Does the person have any life-threatening conditions such as severe life-threatening bleeding? In this instance, unless you do know your coworker ahead of time, you wouldn't know if he had any life-threatening conditions such as severe bleeding. You did try to ask if there's people around who may know the answer. Of course, you can ask them. But in that instance, you would just try to make the better assumption that if he asks him, if you have any life-threatening illnesses, severe bleeding, you would ask the person. If they're obviously too busy choking, you would have to take some assumptions. But if they do nod their head yes to you, even though they can't speak, that's when you have to take it into consideration what to do next. But the initial impression, however, was just that he started choking because you were talking, and he was talking while he was eating. And obviously talking and eating could lead to choking. So you knowing that already, your best impression, your best initial, most educated guess would be that he is choking because you do know the events that led up to it. Is anyone else available to help? So there are other people around because you are eating with a couple coworkers. In that instance, I wouldn't say wait necessarily to see who can help, but kind of ask and make your way towards your coworker while doing all of this. Like who knows how to do the Heimlich maneuver, abdominal thrusts and back blows. There you go. Sorry. So you would ask if no one there seems to know or no one seems to be reacting. That's when you would take the first step, and that's when you would be the first responder in that instance. Verify a person is choking. So you ask them, are you choking? Obviously, if they're choking, they're not going to be able to say, yes, I'm choking, because they wouldn't be there in the first place. But if you say, are you choking, loud and clear, you make sure they are aware that you are talking to them. You will get a gesture, maybe yes or no. If it's yes, you proceed to help. But tell the bystanders to get a first aid kit, get an AED, and call 911. Obviously, those are always necessary for when you are the first responder, because you yourself have to attend to the person or the individual who is going through anything they're going through, choking, bleeding, but also just so you can administer that help, and the paramedics or whoever's available could be already coming while you're administering some type of help, and you don't have to wait for both of them. I'm sorry, I'm gonna sit down. And that's when you would point. Also, very crucial, speak loudly, make sure your words are clear, and you would point to exactly what you want, because you don't have time for people to ask where, how can I get it. Point, you say what you need, and you tell them whatever, it's behind the counter, it's in the corner, just take it out, or get the key, open it. If there's fire, you gotta get the fire extinguisher, anything. But make sure you're always speaking loudly, and make sure you're always pointing and gesturing directly to what you need. You have to obtain consent. Always have to obtain consent. Even if the person is potentially dying, not even dying, but life-threatening, you would have to, if this was the person, my pillow today is my person, this is the person, you would in fact have to be like, my name is Jason, or Jason Conrad, whatever. If you want to give them your last name too, doesn't matter. Just make sure they're aware of who you are. Hello, I'm Jason. You gotta tell them your training or what your level of basically expertise is in helping them at that moment. So you would tell them, I'm certified in CPR and emergency care. I'm a beginner in emergency care and CPR. You would just tell them whatever level you are. So in this case, I would be like, hi, my name's Jason. I'm a beginner in emergency care and CPR, but I can help you administer back blows or abdominal thrusters. I'm so sorry. But you would be ready to help them, basically. Use appropriate PPE. So basically, if you see them, you never want to help someone by touching them with your bare hands. In this case, I have my gloves, so you would make sure your gloves are on. Quick, obviously, but they are latex, so they do take a little bit of time to put on. Always fresh pair of gloves, always clean. And also, you want to make sure you ask if you could provide care, because if you can't provide care, then if they say no, if they don't want any care and you still proceed to provide that care, you're, as bad as it sounds, you're violating their rights, or their right to personal space or whatever they want, because they already didn't give you the consent. So you must always ask, is it okay if I provide care? And if they gesture yes, in this case they're choking, so they gesture yes, you would say okay. And then if they say no, that's when you would have to see if there's another alternative, or wait till the paramedics come. But you would give them 5 back blows. So basically, let's say I'm standing. You would make sure the person is tilting forward. If they have 2 arms, so you want to get under one of them with one arm. Make sure they're leaning forward. And then right in between scapula with your palm of your hand, you want to make sure, always head tilted forward too, just in case it dislodges anything. And you just want to hit them 5 times, 5 good ones. And that's when you would wait to see if whatever they had comes out, if it's dislodged. If the person is still choking, I'm so sorry about that. If the person is still choking, you have to give them 5 abdominal thrusts. So this is when you get behind the person And instead of them tilting all the way forward, leaning forward, you want to make sure you got two hands, lock them, make sure they're locked tightly, right under the rib cage. So you make sure you're not, hurting them every single time it happens. Right in between, under the rib cage, on the sides, and you want to locate the navel with your thumb. So basically, with your two fingers, you want to be here, locate the navel, and that's how you know you're in the proper place. You cover your fist with your other hand, and you count 5 times, giving them the abdominal. Sorry, you count 5 times, giving them the abdominal thrust. So 1, 2, 3, 4, 5. If they're still choking, that's when you would repeat, or you would repeat the back blows. You would repeat the abdominal thrust. And if the food does come out on the first back blows or the first abdominal thrust, then that would mean that chances are they're probably not choking anymore. So see if their reaction after those, see if their demeanor changes, if you start hearing them breathe again, if you feel their diaphragm rising and falling again. You would just wait, ask them, are you okay? Like, do you feel better? They say yes. You wait with them, you make sure they're sitting comfortably, and you wait till EMS comes to further check them out. If they choked or whatever, if they have to go get checked out, because sometimes doing abdominal thrust you can injure your ribs, you could break your ribs. So you just gotta be very careful with that.